So because it affects how they communicate, how they interact, and how they process information. So when your child is growing up, you see symptoms that you notice that it's a bit different. So one of the things is delayed speech, or sometimes they have no speech at all, and they don't relate with other children. They have awkward, way of doing things. Sometimes they just want to be alone, and they have repetitive behaviors. Sometimes they just repeat words, and sometimes even when you try to call them, they don't know that they want your call. They cannot recognize that you're calling their names. So they have all these little things in terms of communication, their social behavior, and how they process it.
So, what are the chances of recovery?
So it's not something that has a cure. However, it's something that we manage. So with support, with training these kids, if we have speech therapists, it should be well. They'll train them how to communicate. But the bulk of it lies with the parents, who are the primary caregivers. So it's advised that, or it's recommended that they give them routine. So because it helps them if they know predict what they should be doing next. So you give them the have a routine for them, what they should be doing every day, and supporting them, help them, with their speech, and sometimes even through, and teach them how to communicate socially. And they're different, so you have to also be patient with them because they're different. They process information differently, so sometimes it's slower. So we're discouraged from telling them that you're a fool, you're stupid, you're slow, you don't use all of these words, and then encourage them and be patient with them and try to just teach them, little by little, how to communicate, how to interact.
Okay, so what is the myth surrounding it being witchcraft?
It's a myth. That means it's not true. Just like any other mental illness, people, especially our people, they associate it to witchcraft, which is not true. So it's advisable that when you notice these things, instead of going first the traditional way and then end up coming back to the medical people, you start with the medical people.